This is your servant, Jean-Daniel Francois. I'm sorry to disappoint you because tonight you were getting ready to listen to Madame Raymond Jean. She has a change in her schedule, so she asked me to cover for her, so I am doing it. So this is just for tonight. So I hope you're not too disappointed. Bonsoir à tous et à toutes. Ce soir, vous vous apprêtiez à entendre, à écouter ou à voir Madame Raymond Jean. Mais notre amie, notre sœur, Madame Raymond Jean, a un inconvénient, a une contrariété. Donc, elle m'a prié de présenter quelque chose en lieu et place de sa présentation. And since I usually go in English first, so I am going to try the English first, and then that will be the French. So here we are again. Gospel Total Ministry is ready to present another page in the health book. We want to talk about PD. What's PD? Parkinson's disease. Parkinson's disease was first described by a British doctor named James Parkinson in 1817. He identified its major symptoms and called it the shaking palsy. Later on, they gave the disease his name. Parkinson's disease, or Lewy body Parkinsonism, is a common progressive neurodegenerative disease. It is a movement disorder characterized by a combination of any of four cardinal signs that I will mention later on. However, it has a variable presentation depending on the patient's overall condition and history. What I'm saying is you may see some sign of Parkinson's, but there may be some other causes. The same way you may have trouble with your memory, that doesn't necessarily mean dementia or Alzheimer's. The same way that Parkinson's disease as a neurological disease also can have features that pertain to other diseases. So don't jump into diagnosis. This is a way for neurologists to make to have some way of making some money to pay the bills. So certain diseases are typically diagnosed by neurologists. Dementia, Alzheimer's, Parkinson's disease, ALS, epilepsy, and so on, neuropathy, and so on and so forth. All the doctors may have an idea of the disease, but nevertheless, officially, the neurologist is recognized to call the shot. The neurologist should recognize the core motor and non-motor features of Parkinson's disease, as well as I said, atypical features that suggest an alternative cause of Parkinsonism. You're going to note that I say Parkinson's disease and I say Parkinsonism. The only thing it means is that some features are not exclusively typical for Parkinson's, but they have tremors and rigidity and so on. So we call that Parkinsonism because they have some features of the Parkinson's disease, but they don't meet the clinical criteria to be called Parkinson's disease. Okay? So other causes include other neurodegenerative causes like genetic causes of Parkinsonism, tremor disorders, non-neurological differentials of Parkinson's disease. We have neurodegenerative diseases that may show up with Parkinson's disease. Okay? This neurological movement disorder is classified as a movement disorder, as a nervous system disease. It affects your ability to control your movement. That's why they're classified as a neurological movement disorder. Okay? The disease usually starts out slowly and worsens over time. As the disease progresses, People may have difficulty walking and talking. They may also have mental and behavioral changes, sleep problems, depression, memory difficulties, and fatigue. If you have Parkinson's disease, you may shake, you may have muscle stiffness, you may have trouble walking and maintaining your balance and keeping the proper posture. Okay? All these can be features of Parkinson's disease. As the disease worsens, you may have trouble talking, sleeping, mental and memory problems. You may have experience of behavioral changes and other symptoms. There are other forms of Parkinsonism that tend to respond poorly to anti-Parkinsonian drug. What I mean by that is sometimes the features look like Parkinson's, but you give the patient the medication for Parkinson's disease, and after 1 month, usually the first month the patient comes, oh, well, I'm doing better, but after 2 months, 3 months, medication doesn't work. You know you got to review your diagnosis and give a differential, but there is no treatment anyway, unfortunately. It's a complex disorder with motor and non-motor neuropsychiatric features. Motor, non-motor, and neuropsychiatric features. Who gets Parkinson's disease? Nearly 1 million people in the United States are living with Parkinson's disease, which is more than the combined number of people with multiple sclerosis, muscular dystrophy, Lou Gehrig's disease, or ALS. This is expected to rise to 1.2 million by 2030. Parkinson's disease affects approximately 1%, we can say, of individuals who are older than 50 years. However, up to 10% of people with the condition may be under the age of 50. You remember Michael Fox, for example? He was diagnosed with young onset of Parkinson's disease in 1991 at the age of 29. According to the Parkinson Foundation, nearly 1 million people in the U.S. are living with PD. When I say PD, I mean Parkinson's disease. Every year, there is an additional 60,000 people, including Haitian American, are diagnosed with the neurodegenerative disorder of Parkinson's. Men are slightly more likely to get Parkinson's disease than women. Parkinson's disease symptoms can be quite difficult to spot at first in the early stage, and many people may be living with it without even knowing it. Sometimes they come to our office, they walk in, I say, oh, you come to see me for Parkinson's disease? Oh, no, I don't have Parkinson's. Oh, no, I don't claim it. They may even get upset because they come to see you, they expect you to give them another diagnosis because they don't like the one of Parkinson's. Parkinson's disease, as a matter of fact, has 4 main symptoms. We talk about Parkinson's disease when we see those 4 main features. Number 1 is resting tremor. That means tremors without doing anything. If you find, then you hold something and all of a sudden you're trembling, that's not Parkinson's. Okay? Parkinson is when you are not doing anything, your hands are there on the table. I ask you to put your hand on your laps, put your hands on the table, on the desk, and while your hands are resting, then you going like your hands are resting. You see my hands? Well, your hands are resting, and you're going like this. And it's usually asymmetric. That means one hand is shaking in the early stage, one hand is shaking, the other one is not. There will come a stage where both of them will be shaking, but usually one shakes more than the other. So that the first thing is resting tremor. Trembling in hands, trembling in arms, trembling in legs, trembling in jaw, trembling in head. Head is your head, we call that head titubation. That's number 1. The other one is called rigidity. You are stiff. Your arm, your legs, your trunk, everything is stiff. You feel like a piece of rock. It doesn't happen overnight, but the rigidity slowly but surely gets worse and worse and worse. The third one is called bradykinesia. Big word, means slowness of movement. Brady means slow, kinesia, movement. So you're moving slowly. If you could see me, you could, I go like this. These people go like this. They're moving very slow. One of the signs of things is that you, all of a sudden, you notice that you are very slow. This can also be a sign of dementia, but we talk about Parkinson's here. So you are slow in moving, so tremor, rigidity, slow movement, and the other part, the fourth one is postural instability. I mean your posture. You cannot keep the proper posture, okay? You are going, you have a tendency to be what you call hunchback. You go like this. Well, these people are walking, they're going like this. That's the way they move. Okay? Another symptom that we find, we neurologists see often is what you call a mask face. Even when the patient is smiling, his face is straight, rigid. You may also have unsteady walk, lack of coordination of your limbs, muscle twisting, spasm, cramps. Let's call it dystonia, hunching. As I said, you're going like this. Parkinson's could cause some patients to stoop over when they are standing up. You might be leaning or slouching when trying to stand up straight. You stoop, you have a stoop posture, you have a hunch over posture. Sometimes you have depression, especially if you know what Parkinson is and you notice you are going to have Parkinson. That may get you depressed, but you need a neurologist like me to cheer you up, to tell you you're going to get better, okay? Other emotional changes, difficulty swallowing, difficulty chewing, difficulty speaking, urinary problem, constipation, skin problems, sleep disruption. You could have dizziness. You could have difficulty smelling. You could have constipation. Your handwriting has changed. You become very small. I call it micrographia. You have loss of smell. You don't smell too well. You don't smell too well. Like if I see someone who has some features of Parkinson, but not really typical, the first thing I'm going to ask him, can you smell this for me? I give him something to smell, like a banana, or licorice, or vinegar, or alcohol. If you're worried about your sense of smell, that's something you need to try. You have difficulty sleeping. This has been going on for years. Changes in your voice. You develop a softer, lower tone of voice when you're talking. Hello, how are you? Sometimes there is a little trembling in the voice. You might even find that your voice sounds hoarse, even though you don't have a sore throat. Okay? Early symptoms are subtle, as I said, and occur gradually. Sometimes people dismiss early symptoms of Parkinson as the effect of, my dad is just getting old. That's why he has a little tremor. Because that's what they say. There are no medical tests to definitively detect the disease. That's why the patients often have the problems. They come to you, you look at them, you listen to their history, you examine them, some basic things. In 5 minutes, you can have a diagnosis. Then you make them walk, you make them turn around. They don't turn like everybody else. They turn like this. You watching? They turn like this. It's called like turning en bloc. They don't turning en bloc. The eyes movement is not really good. They are poor smooth pursuit. That you don't need to know about all these things. Okay? So if you suspect you have Parkinson's, you need to see a neurologist. See your doctor, he may see a neurologist. Sometimes you have doctors who are brave enough, the neurologist said, you have Parkinson's. And the internist says, no, you don't have any Parkinson's. That's okay, you don't have Parkinson's. But After a while, the patient dropped that internist because she or she said, "You were right, doc. I have Parkinson. I told you you have Parkinson." Okay? So don't worry about the sign that much because worry doesn't treat anything. No single one of these signs means that you should worry. As I said, it's a package. We go by 4 signs. You remember them? Rigidity, tremors, hello. What else? You have gait instability, okay? Stoop forward, you have a mass face. Don't forget those things. Don't forget those things. You have some early sign, but no specific tests to do for Parkinson, except you ask the patient to, you want to look at the movement, the eyes at rest, you ask their hand, you see some tremors, you do some cognitive cogwheel rigidity, they cannot follow your fingers, they're walking very slowly, and you push them, you pull them, they can't keep their balance. These are all advanced stage. So because, as I said, there are no medical tests to definitely detect the disease, okay? So what causes Parkinson's disease? Often the patient asks me, what causes Parkinson's disease? Well, Parkinson's disease occurs, we can explain more or less, because we have nerve cells in one part of the brain. It's called basal ganglia. That's an area of the brain that controls movement. If it becomes impaired, or if the basal ganglia keep losing its substantia nigra, when you look at in the MRI, you're going to see that substantia nigra is less and less and less. So these nerve cells or neurons produce an important brain chemical known also as dopamine. So if you don't produce enough of that, you are unable to get good movement. Don't forget, the cerebellum can cause some movement disorder also. We're not talking about this, we're talking about Parkinson's disease, because they have specific classical way of moving, okay? When the neurons die or become impaired, they produce less dopamine, which causes the movement problems of Parkinson's. Scientists still do not know what causes cells that produce dopamine to die. People with Parkinson's lose the nerve ending that produce norepinephrine, the main chemical messenger of the sympathetic nervous system, which controls many functions of the body, such as the heart rate, blood pressure. So these people, when they have this symptom, they may have slow heart rate, they may have a variation in your blood pressure, okay? The loss of norepinephrine may help explain some of the non-movement features of Parkinson's: fatigue, irregular blood pressure, decreased movement of food to the digestive tract. That's why your food doesn't digest too well. Sudden drop in your blood pressure when you stand up from a sitting or lying down position. Oh, it's a complex condition. And when you see the symptoms, we call that, this is the tip of the iceberg. There are so many things underlying. Many brain cells of the people with Parkinson's contain Lewy bodies, unusually clumps at the protein alpha-synuclein. Scientists are trying to better understand the normal and abnormal function of alpha-synuclein and its relationship to genetic mutation that impact Parkinson's disease and Lewy body dementia. You don't need to, I don't need to bother you with all these details, okay? Some cases of Parkinson's appear to be hereditary. I mean, dad had, the child, the son may have, or the daughter may have. But few can be traced to specific genetic mutations. In most cases, the disease occurs randomly. In most cases, randomly. That means that without following any pattern. It doesn't have to be your parents, can come randomly. Don't forget the impact of environment in the disease. Many researchers now believe that Parkinson's disease result from combination of genetic factors and environmental factors, such as exposure to toxins. There are quite a few theories out there, okay? But the primary known cause, what's the main cause of Parkinson's? Don't forget that one. Question of test, quiz question. The main cause for Parkinson is what? Age. When you don't know about those questions, those diseases, what's the main cause of stroke? What's the main cause of Alzheimer's? What's the main cause of Parkinson's? If you say age, you're likely to be right, okay? It's the biggest risk. And according to the Parkinson Foundation, most folks usually develop the disease around the age of 60 and or older. Causes for majority cases are idiopathic, I mean, they don't know, or genetic, or drug-induced. Drug-induced because you see people who are psychotic, who are on psych medication, they have sign of Parkinson's. That's called drug-induced Parkinsonism. Because some medication like Haldol, for instance, a lot of them, Risperidol, they will cause tremors. So if you have a son or a family member who is on antipsychotic medication, watch them, they may tend to have some features of Parkinson's disease. Some calcium channel blockers, high blood pressure medication may cause that. Toxins, okay? So head trauma. You remember Muhammad Ali, okay? The hope and dope, Muhammad Ali used to get a lot of trauma to his head, had a advanced Parkinson's disease. Cerebral anoxia means you don't get enough oxygen to your brain up to some extent, may trigger Parkinson's disease, okay? There are other factors. They talk about pesticide, and in so many cases, 15% of cases have a clear genetic component. Is Parkinson's disease inherited? The answer is no. However, scientists think that about 10 to 15% of people with Parkinson may have a genetic mutation that predisposes them to development of the disease. Predispose, that means you may be more likely to get it, but these are just speculation. There are environmental factors involved that are not fully understood. Symptoms of Parkinson's tend to worsen over time because I told you before, Parkinson is a lifelong and progressive disease with symptoms that worsen slowly over time. About 5 to 10 years, these symptoms continue to get worse, okay? It will become more pronounced as time goes by, okay? Don't forget that it can affect everyone differently. Affects everyone differently. Don't say, oh, I don't have this, I don't have that. No, you can have some features and not all the features, but that doesn't rule out Parkinson's disease, okay? You will have people who can have, I had patients, they have Parkinson's disease for 10, 15, 20 years, and I'm giving them the same medication. I don't even need to increase the dose. They're not doing extremely well, but the disease does not progress, does not get worse. The tremors, the rigidity, the slowness of movement, those things are more or less under control, okay? But I could tell you also that Parkinson's disease goes through what you call stages, okay? It goes into stages. And the stages from the early stage to mid-stage to mid-late stage to advanced stage, okay? But the official classification will be done by the neurologist, okay? The neurologist will examine you and will determine whether or not you have early stage or advanced stage of Parkinson's. How is Parkinson's disease diagnosed? As I told you, there is no specific typical test to say, ha, there is Parkinson's. Look at this. Look at the basal ganglia. Look how atrophic it is. look at how it lost its pigmentations. There is no specific test, okay? But as in medicine, you must also rule out other causes. You may have a tumor in your basal ganglia, for God forbid. So that's why we do an imaging test, such as a CAT scan of the head or an MRI of the head, that may be used to rule out other diseases that can cause similar symptoms. Okay? I will ask my patient to know about his history or her history, head trauma, family history, any neurologic disease in the family, any other symptoms, what medication are they taking, possible exposure to toxin, and then I will look for sign of tremor, look for rigidity, watch you walk, check your posture, coordination, and look for slowness of movement. And voila, we have the diagnosis. We will do the MRI, we will do the blood test, but we already know what the diagnosis is. If you think you may have Parkinson's, as I said before, see a neurologist. Preferably, not only you have to see a neurologist, but there are people who are specialized in movement disorder alone. Okay? So the treatment decision made early in the illness can affect the long-term success of the treatment. Management and treatment, how is Parkinson's disease treated? As I told you, there is no cure, so we give you medications, and we may send you from physical therapy, for some speech therapy, and depending on your presentation and depending on how advanced it is. It's based on patient's presentation, based on the patient's condition, based on the patient's workup result, and overall medical condition. Okay? So there is no cure. Exercise. Watch your nutrition. What you're eating. You remember the recommendation I have. Have a good diet, exercise, drink 8 glasses of water, try to sleep 8 hours. These are the same recommendations for most of the neurological diseases and most of medical disease also. I mean, in other words, follow a strict regimen for your health, overall health, and quite a few diseases. Even if they show up, they may show up much later, and they may be milder than if you don't take care of the preventive medicine that we recommend. Okay? So once symptoms are interfering in your daily life, we will give you some medication to help boost the dopamine level and diminish nerve cell damage. Okay? So don't forget, the diet minimizes the risk of developing Parkinson's disease. So you need some high fiber diets. Okay, you heard that before. The old man keeps repeating himself. Drinking plenty of water. Take medication if it's recommended. If one doesn't work, don't just give up. Ask the doctor for another one. And if you have difficulty moving, be patient, get some physical therapy. Learn dancing, because it's noted that dancing is good for Parkinson's disease. I don't know this. Okay? So prevention, can we prevent Parkinson's disease? No. Unfortunately, no. We can do everything we do to get healthy, but we cannot prevent 100% Parkinson's. We have to learn how to live with Parkinson's disease, lifestyle changes, not walking all by ourselves, taking care, be careful when we're moving, not running too fast and causing you to trip and fall, because Parkinson's people tend to have a lot of fall. As a matter of fact, many of them come to see the neurologist because they've been falling, and when you examine them, you see it's because they have Parkinson. So eat a healthy, balanced diet. It's good for your general health, can ease some of non-movement related symptoms of Parkinson, such as constipation. Eating foods high in fiber in particular can relieve constipation. Okay? So these are the things we can talk about. I hope and pray that you're going to do your best to live in good health. But if any one of your family members, you have anyone nearby, near you, friends or family members, if they have tremors, some difficulty moving, and have them see a neurologist, or tell your primary care to send the patient to a neurologist. Okay? And I hope I was helpful in talking about Parkinson's disease, but you can check out local support group and you can check with Parkinson's organizations. Thank you. I shall return to conclude, but now let me speak to my fellow Haitian American. Mesdames, Messieurs, bonsoir. Le sujet d'aujourd'hui, comme vous l'avez pu remarquer, s'adresse à la maladie de Parkinson. OK, découverte en 1817 par Dr. Parkinson. Nous connaissons une maladie qui est nommée après moi. Vous connaissez ça? The Francois syndrome. Francois syndrome is when you know everything until they ask you about it. I always ask my students, what is Francois syndrome? You know everything until they ask you about it. Anyway, let's go to serious business. OK? Parkinson's disease est loin d'être cette maladie est loin d'être vraiment comprise. Elle a encore ses secrets, comme on dit, c'est dans le son où iceberg qui était crasé Titanic là, il était ouais petite tête là et bien battre un gros bagage qui a crasé bateau, avec ce même genre Parkinson. Ouais petite tête là seulement, mais la pas affecté, la manger système nerveux. La cause n'est pas toujours connue. La maladie se caractérise par la disparition de nombre de cellules nerveuses, les neurones, okay, qui sécrètent un neurotransmetteur appelé dopamine, intervenant dans le bon fonctionnement de nombreuses régions du cerveau, indispensables à la survie des cellules. Maladie Parkinson sont affections chroniques, neurodégénératives, c'est-à-dire il caractérisé par disparition progressive de certaines cellules de neurones dans le cerveau. Et conséquence principale de disparition ça, c'est que ou une diminution de production de dopamine. Dopamine, comme on dit, sont molécules qui permettent cellules pour communiquer entre eux. Donc, dans une région essentielle au contrôle des mouvements. Et nous parlons de basal ganglia. La maladie de Parkinson est avant tout une maladie qui touche les fonctions motrices. Symptômes maladie Parkinson. Qui symptômes yo? Même et yo varie de patient à l'autre, mais premier bagage ou gagne un mouvement, problème ou gagne ou une difficulté pour initier mouvement. Difficulté pour initier mouvement, yo dit akinésia. Akinésie. A privé de kinésie mouvement. Akinésia ou pas qu'à move. Ou pas qu'à move correctement. Un ralentissement des gestes. Tout bagage va faire ou vient slow, très lent. Écriture de plus en plus petit et difficile pour lui. Ou rigide, bras, jambes ou pieds, tronc ou tout corps rigide. Il y a ça hypertonie. OK? Et ou a des tremblements caractéristiques qui réellement paraissent au repos lorsque les muscles sont relâchés de façon asymétrique. Ça veut dire qu'il y a un côté, un bon encore qui secoue plus passer l'autre. C'est un bagage qui est étrange, qui est amusant et bien souvent, patients viennent, ils ont un problème dans les épaules. Et puis, interniste là, orthopédiste fait un MRI, orthopédiste fait un petit bagaille, ils font opération, rien va changer. Les neurologues là viennent, ils disent bon, patient a Parkinson. OK? Donc, ça veut dire que Parkinson manifesté par divers symptômes. Symptômes moteurs, symptômes non moteurs. Souvent invalidant le patient. Ou une grande fatigue, ou une crampe, ou un fourmillement, ou une constipation, ou va sentir bien en néon, ou un problème de santé, mixion, ou une urgence pour aller faire pipi, ou une chute de tension à l'occasion, ou lever trop brusque, tension baissée, orthostatic hypotension, ou capable même tomber, ou suer, ou baver en pile. Tout ça, c'est problème endocrine. Problème de concentration, ou bien anxiété, ou bien la déprime, ou bien irritable, très irrité, facile pour irriter, ou bien trouble du sommeil, ou pas qu'à sentir bien, je dis ça déjà, ou bien voix changer, ou bien problème pour délier langue, pour élocution, ou non qui ne compte parler très bien, ou garde ou pas qu'à parler, ou doit pas laisser à peine si moi sorti, ou gen des douleurs. On veut dire bras et jambes, yo rigide, yo font mal. Là où on douleur, par exemple, on douleur les épaules rigides, des fois c'est pour suivre parce que c'est capable bon avertissement de il est capable pas rien du tout non, mais il est capable un avertissement de début de une maladie y compris Parkinson. Ou il y a aussi un ton ligament, il y a des déchirures dans les épaules là tout, de forme de faut comprendre. Donc maladie à tout capable commencer par une souffrance psychique, par anxiété, déprime, détachement, ou aller par la monde, ou toujours séparé, parce qu'on senti qu'on bagaille qui pas bon. Facteur de risque, comme on dit, premier facteur, c'est l'âge. Il y a l'autre piste pour exploiter, exposition à certains pesticides, métaux, plomb, manganèse, mercure, fer, cuivre, cobalt, exposition à des toxines non métalliques, toxines industrielles, monoxyde de carbone, cyanure, fumée d'échappement, colle, peinture, lac, etc. Survenue de traumatisme crânien, frappé dans la tête ou régime alimentaire pauvre, antioxydants, infection, varicelle, rougeole, rubéole, oreillon, etc. Tout ça, ce sont des indices, on va connaître qui est ça exactement, mais tout bagage ça est capable de contribuer. Tu vois, les petits moun, yo te kon dit pas manger d'aluminium la caille en Haïti, aluminium en bail Parkinson. OK? Mais jusqu'à présent, il va citer là. OK? Il est très probable que des facteurs génétiques et environnementaux qui interagissent entre eux pour capable augmenter le risque pour développer la maladie de Parkinson. OK? Plusieurs pistes sont à l'étude, il y a étudié, mais les formes familiales de la maladie sont rares et représentent entre 5 et 10% des cas de la maladie. En d'autres termes, si par rapport à Parkinson, c'est seulement 10 à 15%, 5 à 10%, suivant ça, mon lit, qui est capable de bonne maladie. Donc, environnement, dans pile facteur là-dedans, pile influence là-dedans, pas oublier. Donc, premier signal, ça a débuté 5 à 10 ans avant l'apparition des premiers signes cliniques. 5 à 10 ans avant mon typiquement gen maladie, il y a des signes. Par exemple, il est constipé tout le temps, ou bien il n'est pas qu'à dormir, il ne pas prendre sang, bagaille. Tout bagaille ça, ou bien et manger ou pas digérer, manger toujours été dans le système digestif. Et parfois, il est diabétique, et pour comprendre, c'est à cause de ça, mais pas oublier. Perte de l'odorat, fatigue, douleur musculaire. Après ça, on a les moteurs, les symptômes moteurs qui apparaissent de façon asymétrique, pas oublier asymétrique. Yon bon, puis trembler, pas sur l'autre. OK? Et gestion ralenti, et écriture a changé, et donc c'est pour faire connaître. Diagnostic maladie, son diagnostic clinique. C'est-à-dire, c'est ou questionner le patient, ou examiner, ou comme un neurologue, ou garder tout ça, et puis, ou faire des tests comme MRI, comme on dit, ou faire blood test, faire tout bagaille pour assurer que pas gain, il n'y a aucune raison autre que maladie Parkinson. L'âge, par exemple, c'est le premier facteur principal, cependant, premier facteur, cependant, et généralement à 60 ans ou plus. Cependant, il y a des gens qui gagnent un petit peu plus jeunes. Par exemple, Michael Fox, qui a gagné, il a 29 ans seulement. OK? Donc, ça dépend de plusieurs facteurs. Si elle frappe peut-être tout le temps beaucoup, ou on prend un coup de poing, on fait boxe, ou a tendance, ou capable de gagner ça, par exemple, Mohamed Ali. Symptômes yo aggravé avec le temps. Ça a affecté tout le monde différemment. Donc, on ne peut pas dire tel monde, c'est tel bagage, tel monde, pas gain tel bagage, il pas gain. Non. Chaque personne atteinte de la maladie de Parkinson ressent des symptômes à sa manière, des symptômes particuliers. Tout le monde pas présenté avec même symptômes yo. Hello, dis ça en pile, parce que je ne veux pas personne quitter et conférence ça avec l'impression que vous n'avez pas diagnostiqué. Pas quitter mal sexe arrive. Pas diagnostiqué. si vous avez un trouble, si vous avez un petit doute, il faut capable de faire un monde garder. Mais en général, la maladie a progressé dans le stade. Il y a un stade précoce, là, un stade intermédiaire, là, un stade mi-tardif et un stade avancé. Généralement, et si c'est en France ou certains pays Europe, en Afrique, classement légèrement différent, comme on dit aux États-Unis, c'est précoce, intermédiaire, mi-tardif, avancé, mais en Europe, il y a plusieurs stades d'évolution. Il y a un stade 1, pas aucun impact spécial sur la vie quotidienne. Ça, c'est le stade premier stade. Ensuite, il y a un stade 2, côté signaux en bas, unilatéraux, et commencer à occasionner antigènes dans les actions du quotidien. Stade 3, si la maladie devient bilatéraux des deux côtés, posture la modifiée, autonomie est conservée, il n'y a pas de handicap grave pour le moment. Stade 4, où il y a un handicap sévère, assez sévère, que le monde est capable de voir, si patient capable de marcher, mais autonomie limitée. Et dernier stade, c'est stade 5, c'est le stade le plus avancé de la maladie. La personne perd son autonomie, la recherche et la marche devient impossible. Elle doit se déplacer sur fauteuil roulant. Il faut qu'il y ait des gens qui pour Kembel pour ne pas tomber. C'est presque le même bagage, ça nous dit en anglais, en américain. Maintenant, traitement, c'est médicaments. Parfois, obligé de faire cette opération, chirurgie. C'est ça qui arrive Michael Fox, à 29 ans, il était à Fordley, il est obligé de faire des tests au monde, et pour capable, bon, et puis il était capable de faire des altérations et d'appeler, c'est-à-dire pour faire des manipulations, pour capable d'aider pour continuer avec problème lié dans la tête. OK? Ça veut faire et you stimuler l'électrode pour voir qui région précise dans le cerveau qui réagit et puis il relié par un câble en bas pour patient et puis pour capable voir qui bon et puis il apporter des plus capable un soulagement considérable transformation réelle de la vie des patients. Technique c'est très efficace sur les tremblements, sur la raideur et la difficulté à effectuer les mouvements. Ça son bémol, mais stimulation cérébrale profonde ne peut être proposée qu'à des personnes malades depuis plus de 5 ans et qui peuvent présenter des troubles psychiatriques. Depuis pour entrer dans le brain, ou par contre, ça va joindre. Donc, il faut prendre précaution. Il y a des approches non médicamenteuses, kinésithérapie, physical-thérapie, pour entraîner muscles, articulations, rééducation, orthophonique, améliorer la déglutition, pour capable de parler, valer, comment pour écrire, traitement à ne pas négliger, parce que tout ça est important. Overall, my dear friends, Parkinson's disease is another neurodegenerative disease that affects 1 million people in America. We remember dementia was 5 million. Okay, so, but by 2030, it will be 1.2 million. Every year, there are 60,000 people diagnosed with Parkinson's in America. So that's something that 60,000 may not sound a big deal, but if it happens to one of you or one of your friends, it's a big deal. So what do? You have to treat yourself well. Exercise, eat properly, sleep properly, drink enough water, take your medication, see your doctor, and if you have any doubt, see a specialist to evaluate you. I hope everyone enjoys a healthy life because that's what we want to do. Exercise as much as we can, even if you have some sign that limits you. Remember, once you get clearance from your cardiologist, you should exercise. It will prolong your life. It will prolong your life. You should exercise, eat properly, sleep properly, and have a good spirit. Have a positive attitude, and you do your best, and the Lord will do the rest. My beloved, I hope that you will be fruitful and you will prosper in every step of your life, in every domain of your life, and ultimately, I hope you trust in God, because no matter what happens, this body is condemned to be destroyed, but if we have the hope of everlasting life, that will make a difference. So I'm ending early today because I want to give you a break. So enjoy my gift of 15 minutes for the rest of the evening. By the way, please do not forget, subscribe and share. These are the way for us to increase our numbers of people who can watch whatever is going on and share. Please, I'll appreciate it very much. Partagez, souscris, abonnez, ou pas payer 5 pour ça. Donc, faites tout effort qui est possible pour capable un des nôtres et faire l'autre monde. Fait gamme pour nous, fait monde pour nous grâce à Dieu. Et bon Dieu a béni nous. Nous vous remercions en pile pour ça et passez une bonne nuit. Hasta la vista. Le prochain rendez-vous demain soir, 7h, 8h, nous avons une prière sur la ligne. Nous pas pour on camper là dans l'écran de 7h à 8h, mais nous avons une prière sur la ligne, nous attendons sur la ligne. Et à 8h, nous avons un pasteur, professeur Joseph Deli, qui a parlé, qui te Bible à parler. Et samedi matin, nous avons un service de 8h30 à 10h30. Généralement, programme samedi matin, 8h30 à 10h30. Nous essayons généralement de finir avant 10h30 pour avoir notre activité. Et puis, lundi soir, c'est yours truly, votre serviteur. Nous toujours présentons un sujet. Et les jeudis soirs, Madame Jean, jeudi, elle a un inconvénient, c'est ça que fait moi présenter le sujet ça. Merci et à bientôt. Bye bye.